This is Isela Aparicio, and I am a junior at the University of South Florida and a health sciences major. This is my presentation on anesthesiology assistants. The scope of practice of anesthesiology assistants is determined by the directing anesthesiologist, which they will be working under, the hospital credentialing body, the state's Board of Medicine, and state regulations, which would differ from state to state, so Florida would be different than Louisiana. The scope of practice is very similar to that of nurse anesthesists and anesthesia care teams, which the anesthesiology assistant would be working with. Anesthesiology assistants hold many different daily responsibilities, such as taking a complete health history for their patient before performing a physical examination. They may also pre-test devices that will be used in order to deliver anesthesia. They may assist in life support when necessary. They may work in ICUs, and they may do pre-testing and calibrating of anesthesia delivery devices. They may also prepare the patients to be monitored using non-invasive and invasive methods as determined by their doctor. So the anesthesiology assistant does many different activities, and they would work in conjunction with a physician or possibly a nurse. Anesthesiology assistants may be found in many different settings, not as much as other professions, possibly such as nursing, due to the fact that anesthesiology assistants do work specifically in surgery or administering anesthesia, so they may be found in large medical facilities or hospitals and mostly surgery centers. Most of the places that they tend to work at tend to be very large places. Anesthesiology assistants work directly under the watch of an anesthesiologist, which would tell them what to do. And then they work with anesthesia care teams, which may consist of nurses, other PAs, and other technicians. The anesthesia care teams may consist of nurses and physicians. Anesthesiology assistants may monitor patients after surgery, as well as the anesthesiologists and the nurses. They all work in conjunction to monitor and make sure that the patients are okay and that their anesthesia levels are where they should be. A person seeking to become an anesthesiology assistant would want to first get their bachelor's degree, which would consist of many pre-med classes such as organic chemistry, biology, and also anesthesiology assistants are required to take calculus. After completing a bachelor's degree, in the process of completing a bachelor's degree, a student would take the GRE or MCAT, which are required in order to apply to an accredited master's program in anesthesiology assistance. Once in a master's program, a student seeking to become an anesthesiology assistant would take 2 years of coursework, which would encompass subjects as anatomy and pharmacology. In the process of getting their master's program, they will complete a clinical portion in which they would administer 600 different anesthetics. And this is all used in order to gain experience for the real world. Once the master's program has been completed, a certification exam may be taken in order to become certified as an anesthesiology assistant. Following graduation, an anesthesiology assistant would take the NCCAA exam to become certified. Following this, they would have to complete continuing medical education every 2 years, and this would consist of 40 hours. Following this, every 6 years, an anesthesiology assistant would take a continuing demonstration of qualification exam in order to maintain their certification. There are many professional organizations that support anesthesiology assistants and that are wonderful resources for an anesthesiology assistant to join, such as the American Academy of Anesthesiology Assistants and the Florida Academy of Anesthesiology Assistants. These are wonderful ways to meet other anesthesiology assistants as well as advance in one's education and be able to find a job.